Tell us a little bit about endometriosis, why it happens, because this is what most people want to know.
To be honest, there is no such science which tells us why it happens to a particular lady.
What are the issues with surgery which people need to know about?
In India, it is common that we hear about something called as unindicated hysterectomy.
Hi everyone, I'm Dr. Aarti here, and we have with us Dr. Mehta, the expert on endometriosis, with us to talk about this silent epidemic affecting so many women. And it's very often just dismissed as normal period pain. There is delayed diagnosis because it is taken for granted. They don't go to a doctor on time, and it affects 1 in 10 women. So I think it's high time we talk about this disease with the expert himself. So hi Jay. Jay, tell us a little bit about endometriosis, why it happens, because this is what most people want to know.
To be honest, there is no such science which tells us why it happens to a particular lady. All we know at the moment is that it is something which is related to hormones like estrogen and progesterone. And there could be a variety of factors. There could be immunological factors. There could be factors related to estrogen and progesterone resistance. One theory, the old theory of retrograde menstruation, and a multiple other factors would play a role in this particular disease as to why it would occur to somebody, right? But for a particular lady, we will never be able to point out that you had endometriosis because of this condition. You did this due to which this happened. So honestly, we will not be able to point it out like that. But yes, it's common. It's getting more and more common, not because it was not present before, but simply because it is getting diagnosed much more commonly, frequently, faster and better as compared to what it used to be in the past.
So you are seeing even teenagers and young women with this disease.
It can happen to anybody. So it can happen right from puberty to postmenopause. We've done countless women who are postmenopausal with grade 4 endometriosis with bowel nodules. We have done countless girls who are 11, 12 and 13 associated with Mullerian anomalies, and they've had severe endometriosis. So when people tend to say that, I think I don't have it, that is simply, an overreaction to a lack of knowledge, or, something which they've tried to self-interpret based on the social media forums and all these types of things, which practically does not help them in any manner apart from satisfying their ego. So I personally think if it is a medical condition, like how you go to a bank when there is a banking issue, if it is a medical condition, you need to go to a doctor, consult your doctor, get treated, get sorted. Because sorting it out on time is the most critical aspect of treatment of endometriosis.
So if a young girl or a woman is having severe pain during periods, or even pain during intercourse, or pain during passing urine, or while passing a stool, you urge them to go and see a doctor.
Correct.
Right? And what is the treatment once the diagnosis is made of endometriosis?
So when we talk of treatment of endometriosis, we want to talk of at present, right? So as we speak to each other in 2025, the treatment for endometriosis is surgical excision. Okay, this is the bottom line. So for people, see, what is going to happen in a country like India is, because there is very limited specialization for endometriosis available across the nation, people will try and go to their routine family gynecologist. Now, the gynecologist may be an extremely good person, extremely well read, but may or may not specialize in endometriosis, due to which what will happen is that they, as a patient, will get prescribed with unindicated and temporary medications like Dynogest. Now the thing is like with elagolics or, Depo. And the only thing which we see as specialists is people have been on Dynogest for 4 years. People have taken elagolics for 6 months. You can take this, no problem. I mean, it is a good medication for temporary pain management. That is what the medical management is for, even according to the manufacturers and the textbooks. Now, if you interpret that, no, but I have seen people getting better on Dynogest, you're basically lying, because the disease process does not listen to you or me. The disease process has been scientifically proven across the world. Correct? So the biggest problem is people taking unindicated medical management, thinking it will cure them. It does give them pain relief, but the disease continues to grow.
Right.
So you are actually taking medicines to increase your disease. Now, if in case you want to do that, you are absolutely welcome to do that, because in a country like India, the patients very rarely will follow guidelines, and they have the liberty to play around with their own health.
And that is the reason why diagnosis is delayed, and also the right surgical advice is delayed because they're taking medical management, and the disease becomes from a single compartment disease
Correct.
to a
To
multi-compartment.
multi-compartment. It's very simple. See, if I am an endometriosis specialist, I looked at a patient and I told them you need to get operated. You went and took a second opinion from a person who is not an endometriosis specialist, and that chap has never done surgery in his life. You know what happens in India, right? Like, people who are going to project themselves as surgeons are going to call ghost surgeons from outside and get people operated. So what will happen is that particular chap will say, oh, I don't think it needs to be done. Now he has or she has said it because they've never operated endometriosis. Correct? So the patient gets confused. Oh my God, a 37-year-old chap told me to get operated, but a 65-year-old chap told me don't get operated. They don't understand that 65-year-old has never done it in his life, which is why, despite having gray hair with seniority, he is unable to give the correct advice. Correct? And then the patient gets swayed away. And this is common in India. In fact, it is so common in India that majority of the girls who see us once, they will come back to us only for surgery, but after 2 years. When, as you correctly mentioned, they've gone from a single compartment to a multi-compartment, which is bad for them.
Right. What about your take on why is it that people get worried of surgery, and why is it that doctors don't advise surgery immediately? What are the issues with surgery which people need to know about?
I'll answer this in a different manner. In India, it is common that we hear about something called as unindicated hysterectomy. Correct? Uterus removal was never required, but the lady underwent a hysterectomy. Why? That is because now hysterectomy has become a well-trained subject. You have people in tier 3 and tier 4 cities who are doing hysterectomy very nicely with laparoscopic surgery. So it is an easy access. The problem with endometriosis is the access is very tough. It involves a lot of other organs, and as a result of which you need to be very good surgically to operate on multiple organs, which very few people are. And this is very difficult for somebody to see. If I am a doctor, I need to be a very good doctor for me to accept that I don't know a particular thing. If I'm a substandard doctor, let's say if I'm an ordinary doctor, or if I'm just managing my ends, I will always try to project that I am knowing everything. And when I try to project like that, right, I will never be able to learn endometriosis surgery. And because I don't learn it, I am unable to offer that benefit to the patient.
Right. So this surgery has to be done by an expert in the surgery who knows the anatomy, who knows how to clear the disease completely through all the compartments, is what your take-home point is. But then let's say an expert does the surgery. What is the chances of recurrence? That's another commonly asked question.
The most important thing which we need to convey here is that this is a chronic disease where the rate of recurrence is going to be the least if an expert is going to be operating upon you.
Right.
Let's assume a novice is operating upon you, then the rate of recurrence is 100%. Let's assume, you know what we see commonly, people are doing endometriosis surgery where they just drain the cysts and come out, rate of recurrence is 100% in 3 months. But when an endometriosis specialist is operating, two things are important. One, the rate of recurrence is going to be less than 2%, 3%, 5%, whatever, based on the amount of involvement. But pain relief is going to be fabulous. And majority of the times patient will get operated for pain and fertility. Pain relief is fabulous. Fertility enhancement is unbelievable because you are able to restore anatomy to like how it was. Correct? And when you are able to do that for a patient, definitely the patient experiences surgical benefit. And this is again not my science or anybody's science. This is literature. This is scientific literature available on all platforms, completely verifiable across all LLMs, large language models, completely verifiable across all sources.
Right.
So this is the science. You need to do this.
Like you mentioned, patients are getting the surgery delayed and taking unnecessary medical management, and surgery is going to offer pain relief, definitely. But then also we have to concentrate on the fertility aspect of endometriosis. The endometriosis does affect the fertility. Absolutely. And the more you delay surgery, the more this endometriosis is going to eat up the ovarian reserve. And even if you're going to do surgery at a later date, you're having such low ovarian reserve that even post-surgery, you're going to have very, very less number of eggs to do whatever ART treatments with.
Absolutely.
So that is again another take-home message.
Absolutely.
A stitch in time saves 9.
Timing.
There is timing.
As we talk in cricket, timing is important. In endometriosis surgery, timing is even more important.
So a stitch in time saves 9. If you are operated, we have patients without any symptoms of endometriosis, 6 months married, just went for a routine checkup, has severe endometriosis, and they are not open because they are asymptomatic.
See, that's the problem in India. People are so so empowered falsely.
Right.
You know, false empowerment is very bad. When you have no knowledge but you bark about it, it's very, very bad. Correct? And this false empowerment, where we try to give patient an informed choice, but the patient is taking an uninformed choice. It ends up screwing up their own health. But you know what? It is a matter of somebody's destiny. If you are destined to get screwed up by taking incorrect decisions in life, you will take incorrect decisions in life, no matter whom you are consulting.
But then we are having this podcast so that our patients are better informed from an expert, and hopefully this scientific information and experience we have of treating thousands of patients with endometriosis, with adenomyosis, we are, reaching out to them so that they don't take those wrong decisions for their own good.
Always remember one thing: when we do endometriosis surgery, the patient who is in pain, they want pain relief.
Right.
The patient who is asymptomatic is going to be the problem patient. In fact, it is the asymptomatic patient whom we want to operate the first.
Exactly.
Because she is asymptomatic, we want to make sure that before she develops symptoms, or before it is too late that every organ is involved, we want to operate her. It is going to be very difficult for somebody who is an idiot to be convinced that you are an idiot. Correct? But once you realize it, that no, yaar, something is wrong with me, then you never need to convince a patient. The patient is going to walk into you and tell you, do their research, whatever little they understand, they are going to follow, they are going to understand the depth of the science, and then they are going to come to you and tell you that no, we want to get operated because now we understood that this is bad for us, right?
Yes.
When this eureka moment occurs to a particular patient or a particular family or social circumstances, when it comes to a country like India, that is simply a matter of that patient's destiny, nothing else.
Let's hope that women are better informed and they take the right decision on time for their own sake.
Correct.
So last two questions, Jay. Anything about lifestyle, endometriosis patients, anything they can do to at least decrease the speed of progression of the disease?
So see, endometriosis diet has come up in a very big manner.
Right.
We have been doing some research on it for the last now almost 7 to 8 years. And we have published endometriosis diet across our websites, which is available to people for free download. If they want to choose to download it, it's completely fine. It doesn't cure you out of endometriosis. It simply reduces the inflammatory state in the body. That's it. So it may help you in doing some pain relief. The best time to take an endo diet is after the surgery, not before the surgery.
Right.
Correct.
So an anti-inflammatory diet.
Anti-inflammatory diet after the surgery is the best thing to do.
Then it lessens the rate of recurrence.
Absolutely.
Right. And lastly, what is your message to these women who are struggling with endometriosis? What is your advice to them? As
I told you, frankly, I have no message or no advice because we are not living in an era where we are, we should not be advising people who are empowered. So we should not be advising people. So
what are the common myths you wish they knew were just myths?
One, I understand it's very difficult to believe another human being, but I'm sure it is easy to believe a computer, right? So simply for the sake of your own health, just log in to any platform you want to and study what is the fact which is told to you by a platform and not told to you by another human being. Not me, not the social media forum, not the Reddit and the Quoras and the support groups which you are reading through, because the support groups are very, very biased. Most of them are paid support groups and most of them are going to be promoting a particular person who has paid to be promoted on that support group. So be very, very careful of that. Trust a computer. A computer is not going to lie to you. Computer is going to give you a scientific, exact information. If you think the computer is not hallucinating, which is a common flaw as far as AI is concerned, as we speak as of 2025, seek the correct medical guidance following that. When you seek correct medical guidance, go back to your AI. The AI will help you take an informed decision, not a social decision. My auntie said not to do this. My grandmother's doggy told me don't do this. My sweeper came and told me that it is very painful. All these types of myths which cloud your decision making. You should seek advice of an AI and you should get treated on time.
Thank you so much, Jay. That was wonderful and very helpful, I'm sure, for patients who are struggling with endometriosis. Thank you.
Thank you so much.